Now, doctor, can opiates be taken safely?
They can in small doses. Usually now, I think most of the time it's in the hospital, maybe after surgery for a couple days. But as an outpatient, somebody taking things at home, we're really trying to get away from that because unfortunately they can be addictive, and that doesn't place blame on anybody in particular. A lot of people don't want to be on these drugs, and they do end up being addicted on them, so it's hard.
Now, if you have an addiction to opioids, what steps should you take to get clean?
Well, the first thing is to go see your doctor about it. There are a number of drug treatment programs in South Florida that are available for people to go to, either inpatient where you stay in the hospital, or you go every day, but then you go home at the end of the day.
Now, and separate from opioids, you can actually now take maybe a stronger Advil or stronger Tylenol as well, correct?
Right. If you look at the data, most of the time opioids actually don't really help with pain after a certain amount of time, so that's why we try and for people who have chronic pain to use other medications other than opioids, anti-inflammatories, things like that.
Now, along the lines of addiction, mental health is another big topic overall from 2018. Now, do you find that people are being more open about mental health these days? I feel that it's something that's being more spoken about, and that makes me happy.
Yeah, it is. People are comfortable talking about it. We still have issues with a shortage of mental health care providers. There's often long waits to get people seen by the mental health professionals. Right. So people are more open to talking about it. The problem now is getting people treated.
Now, there's still a stigma, though, around mental health. And tell us about that stigma and how it affects the care and treatment of patients needed.
Yeah, I mean, everything from family relations to work and job applications, life insurance applications, things like that. There are inquiries about mental health. And there is this stigma of being labeled as quote-unquote crazy because you have depression or anxiety, but both those depression and anxiety are very common, but people are still ashamed of talking about it.